Yeah, I would like to thank first all of our colleagues preparing this report. We have just distributed War, Migration and Health Experience of Turkey. I thank all of the collaborators of this report because of their hard work to bring this report to this meeting and translating on time. Thank you all of them. Yeah. You all know that Turkey is in a deep problem of migration, war, and armed conflict. We know that about 3 million immigrants are in Turkey. Most of them are from Syria, almost 2.5 million people from Syria, and about 250,000 people from Afghanistan, Iraq, Iran, and Somalia. We have about 2.4 million Syrians registered through biometric records and were given temporary protection and identity cards. There are many, actually we don't know the exact number, unregistered Syrians in Turkey. Many Syrians are targeting to reach European countries. The most vulnerable ones are staying in Turkey. They don't struggle to go to Europe. As for the social determinants of health for immigrants, I should first talk about shelter. Only 10% are staying in temporary settlement camps. 90% of Syrians are living distributed all over Turkey in very difficult conditions, in nylon primitive tents in metropolitan or rural areas, abandoned buildings, rented houses in slum areas of big cities. According to official records, about 1/5 of Syrians do not have access to clean water, access to bathroom and toilet. 40% don't have soap and basic hygiene material, and nutrition is inadequate and irregular. There is a big problem about employment of these immigrants. They mostly work in temporary works in urban areas and farms with low wages, about 1/3 to 1/2 of minimum wage those earn in Turkey, which is about $200 per month, which is really a severe exploitation of labor. Child labor is quite frequent. Because of child labor in shoe making workshops, there is polyneuropathy widely seen in these children. And again, discrimination and hostility in workplaces are quite frequent, unfortunately. About access to healthcare, temporary protection to registered Syrians, they have access to demand-based healthcare, which is covered by the government. Others are subject to different processes. Syrians are not registered to family physicians, which is one of the most important problems in Turkey. Preventive services like antenatal care, follow-up of children, reproductive age of women, and vaccination of children are quite inadequate. Language is a strong barrier between healthcare professionals and the immigrants. I'm sure you know many people die in Aegean Sea, East Mediterranean Sea, while trying to reach Europe. Alan Kurdi, which is a child, 3 years old, died last summer in Bodrum coasts. Unfortunately, after Alan died, according to data of IOM, International Organization for Migration, 340 more children died in the Aegean Sea. People die in useless rubber boats with false life jackets in Aegean Sea. It's very dramatic that Syrian children and women work in workshops producing false life jackets which don't save life in Turkey, especially in Izmir. Yeah, again, according to data of IOM, last summer and in 2015, about 3,770 died in Mediterranean Sea, most of them in the Aegean Sea, in the East Mediterranean Sea. Yeah, this data again from IOM. In the first 2 months of 2016 until February 23rd, about 110,000 people reached Europe, most to Greece, you see. More than 100,000 people reached Greece and 321 died within less than 2 months in 2016. The human tragedy continues. Yeah. This map shows deaths on the way of migration throughout the world. We see that again in 2016, 567 died on the way of migration, and you see that 413 died in Mediterranean region, again most in the East Mediterranean region. This geography seems to be the most deadly route of migration in the world. Yeah, I'm sure you know this news. It's said that there is a discussion between European Union and Turkey. European Union offers up to $3 billion, euros, to stop migration to Europe. They say that we can give you 3 billion euros to tighten your borders. Yeah, we don't think that this will solve the migration problem. Especially the timing of this visit was striking in Turkey. Just before general elections, about 2 weeks before general elections, there is a strong impression that this was a sort of political gift, unfortunately bargaining on immigrants, bargaining on this human tragedy. Yeah, another very important problem in Turkey, unfortunately there is another burn in southeast part of Turkey. There is ongoing curfews. According to data from Human Rights Foundation of Turkey, there are ongoing curfews, and more than 350 died. 350 civil people died during these curfews. And in Sur, more than 80 days of curfew going on, and in Cizre, more than 70 days of curfew. Actually, we cannot say curfew to these because people are at their home. They are unable to go out all day, 24 hours, day long. They are actually unable to go out of home. These pictures are from Cizre after 70 days of curfew, and from Sur after 80 days of curfew. And we see that many people had to leave their home. We don't know the exact number, but we assume that more than 100,000 people had to leave their home from these regions. And we have a severe problem of internally displaced people, in addition to immigrants from Syria and Iraq. During curfews, we see severe problems about reaching healthcare services. You see this picture is a picture of a patient trying to reach hemodialysis to the hospital with white flags. There are many attacks to healthcare workers, unfortunately, in the region. Abdullah Biroğlu, a physician killed by PKK in the region, and Eyüp Ergen is a nurse killed, according to eyewitnesses, by security forces, and Abdulaziz Yural, again a nurse, killed while helping a woman injured in the region, and the driver of this ambulance, Sheikh Muzdursun, was killed while driving to reach and injured people, again in the areas of curfew. Our colleagues raised their voice for peace. They made activism invite for right to health. They started White Turn for right to health. Physicians, nurses, and health staff attended this White Turn. In Diyarbakır, Istanbul, Ankara, and Izmir, they did these White Turns for about 3 months. I should say that Turkish Medical Association is always against war. We made many activities against war. This is from one of them. At the 100-year anniversary of the First World War, you know, Gallipoli Wars in the Çanakkale, Gallipoli Peninsula, we made an event together with Australian and New Zealand medical associations against war. Yeah, you know that one of the most tragic events of the world history. I would like to say what physicians do according to our view. We understand that governments should see that physicians' primary duty is providing healthcare services to everyone according to their needs while protecting universal professional values. Physicians should be able to perform their professional responsibilities without any kind of oppression, intimidation, or political pressures such as criminalization of healthcare services. Physicians and national medical associations should stand for the right to health of refugees, migrants, and internally displaced people. This responsibility includes advocating of better conditions, access to the healthcare services, and preventing discrimination and stigmatization. We believe that physicians and national medical associations also should advocate peace, since wars and conflicts deteriorate the conditions which determine health status of people. Physicians are the voice of peace. Thank you very much.